So here's some more sideline movement tests. We're going to test hip abduction strength, so just pure abduction, glute med, glute min, tensor fascia lata. Then we're going to test hip abduction with lateral rotation, which is the posterior fibers of the glute med. And then we're going to test the length of the tensor fascia lata. So how far can she move into hip adduction, also known as the Ober's test. And then lastly, we'll test the hip adductor strength. So I'll show you all four of those tests right now. So this bottom leg, I really like to keep bent just for some stability and comfort for the patient. This top leg we've talked about in class is really important to make sure they're in a neutral alignment. So don't let them creep into flexion because that's going to show dominance in the tensor fascia lata. So this first one is a neutral position, foot pointing straight ahead at you guys, and we're just going to have her come up into abduction and back down. Again, can she reach up to my hand? Back down. Go ahead and come up, hold. I usually start at the knee. She starts to come into flexion, so I'm just going to correct her a little bit. You okay? Okay, don't let me push you down. Hold. And then if they feel comfortable there, their knee's okay, you can come out here and push down. Okay, so that's hip abduction strength. We're testing glute min, glute med, and tensor fascia lata in a neutral position. You couldn't really see real well, but she wants to rotate a little bit, which talks about maybe some abdominal control, which makes sense as she is pregnant, right? So that's probably not going to be firing appropriately at this time. And then she wants to come into flexion, so that TFL really wants to help her out. Okay, so that's the first test, neutral rotation, toes pointing straight ahead, just straight abduction. The second test, we're doing abduction and lateral rotation. So again, I'm going to have her in that neutral position. I'm going to laterally rotate, and then I'm going to have her lift her leg up. Okay, so come back a little bit, toes up to the ceiling, come up, and she wants to come into flexion right away again. So I'm going to say, can I push you forward a little bit? Can your leg come back, toes to the ceiling? Which is really, really hard for her, right? So she can't laterally rotate. Those hip flexors at TFL might be short, which we've seen in the past. And as she comes up, right there, and back down. So again, with this lateral rotation, we're testing the posterior fibers of the glute med. Can you hold that for me? She says she'll try, so it's already hard. Don't let me move you. Hold. And she wants to jump right into flexion, right? So she might feel like she's strong, but that TFL is really taken over, right? So I can't get a true measurement of that posterior glute med fibers because the TFL is short and stiff, and it can't laterally rotate as well. So you're going to see a pattern like that consistently with her. We saw it in supine as well when we tested iliopsoas and tensor fascia lata. So not surprising to me, but you're making a note of that. So we have neutral abduction, which we did first, abduction with lateral rotation, which we just did second, and then third, we're going to do basically the tensor fascia lata length test, or Ober's test, okay? In order to do Ober's, it's really important, we gotta stabilize the pelvis, and we gotta make sure that we're able to get extension, lateral rotation. So I'm at the femur, I need to laterally rotate her, and guess what? It's hard to do, right? So the TFL is telling me again, and then I want to adduct. Can I get her to the table? And she wants to laterally flex at the spine. So she's not down to the table, so that'd be a positive test, right? In order to be a negative test, she's got to hit the table, which is about 10 degrees of hip adduction. Now, she could probably hit the table, which she is right now, but guess what? She's getting a lot of motion at her lumbar spine, so you have to make sure you feel when that pelvis wants to give, and you stop there. So again, extension, lateral rotation, adduction. Okay, so she'd be positive for TFL. So now we have really three tests that are like, hey, TFL is a problem here. Okay, So we're gonna treat that eventually on her. All right, last but not least, we're gonna test hip adduction strength. So I'm gonna hold this top leg here. I'm gonna have her straighten her bottom leg. And now we're testing the strength of the bottom leg. Okay, so I'm gonna ask her, can she raise her bottom leg up to her top leg? And back down. Is that okay? That's pretty hard, right? So again, kind of see how hard it is. Have her come up and hold, and I'm gonna push down, don't let me move ya. And she's already going down, she's like, I don't wanna do this. Okay, take a break. So right, if you already feel them drop, then you can start grading them. So hip adduction strength on this is a little bit weak. Again, if it's real weak at the very top of the range, you lower it 10 to 15 degrees, and it's strong, that would tell us our hip adductors are long. Okay, so I just went through 4 tests. Okay, so if you're confused as to what happened, go back, and I went through neutral hip abduction, I went through hip abduction with lateral rotation, I went through Ober's test, or the length test of the TFL, and then I tested the strength of the hip adductor.